Our topic today is not just simply about COVID-19, but what the heck happened. We're going to talk about Twitter files, censorship, and a story that, quite frankly, you'll never believe.
A clear path forward requires looking back and learning. Good public policy requires human connection. It's a consideration of the facts, applying common sense, and innovation. It's urban, it's rural, it's real life. We all have something to contribute. We all have a responsibility to get informed because there's a little piece of Canada in all of us, isn't there? Let's learn on this path together. This is Leaders on the Frontier.
Well, I'm very excited to have today with us two preeminent scientists in the world, quite frankly, in public health. Dr. Jay Bhattacharya is a professor at Stanford University Medical School. He's a physician, epidemiologist. He's also a health economist and also a public health policy expert focusing on infectious diseases and vulnerable populations. And then we have Dr. Martin Kulldorff. He's a professor of medicine at Harvard. He's a biostatistician and epidemiologist with expertise in detecting and monitoring infectious disease outbreaks and vaccine safety evaluations. And if that was not enough, he's also a senior fellow at the Brownstone Institute. And quite frankly, they're also not only smart, but they're also my friends. So I'm delighted to welcome them here today.
Thank you, David. So good to be here.
I'm very excited about this conversation today. Our last conversation together on Leaders on the Frontier, it's hard to believe, was back in September 2022, and that's some 6 months ago. And everything has changed, and I don't think that's an overstatement. But it just at a glance, would you say that we've learned a lot looking back the last 6 months alone?
I think the last 6 months have made clear a number of things. First, the collateral harms from lockdown have become more and more evident to the point where they're just undeniable. In particular, the harms to children have become abundantly clear, with study after study showing deep learning losses, especially in poor children. The evidence from the poorer parts of the world show poverty, increases in poverty, increases in malnutrition, and even frank starvation that we haven't seen in a generation. And we're starting to see the health effects of the lockdowns even in richer countries as the cumulative effect of delaying basic preventative medical care are taking its toll.
What about you, Dr. Kulldorff? What would you say in terms of some of the things that you've observed that have changed?
Well, if we look at excess mortality, most Western countries have now excess mortality that's not due to COVID, but due to other things such as the lockdowns, uh, cancer screening that didn't happen, and so on. Diabetes care wasn't as good, lack the cardiovascular disease, or mental health problems. And if we compare the Western countries, the one country that does not have this excess mortality, the lowest excess mortality from 2020 to 22 is Sweden, which did not lock down in the same way as other countries did.
Wow. So I think a lot of people listening would be kind of shocked by that. So I just want to make sure we understand that. So you're saying that the mortality of COVID-19 wasn't so much the issue, it was the response to it. Is that right, Martin?
Yes, correct. Um the lockdowns did not help with COVID-19. It might have postponed the problems a little bit, but Sweden has one of the lowest COVID mortalities, not the very lowest, but one of the lowest. But when it comes to excess mortality, where you look both at mortality from COVID and mortality from lockdowns and other pandemic measures, Sweden is the lowest.
So if so you would say, Martin, that if the facts are looking back now over the past 3+ years, that Sweden did it right. Is that the conclusion?
Sweden got it right, and most other places got it wrong.
Wow. And so what I find fascinating about this is we talk about the Great Barrington Declaration, and that was the place where you came up with this statement. You, Martin and Jay, and also Dr. Sunita Gupta from Oxford University came up with this incredible statement some years ago, October 2020, as I recall, that basically said what? What can you refresh our memories about what that statement said and why did you write it? Jay?
Well, the Great Barrington Declaration was premised on two basic scientific facts that were clear from almost the earliest days of the pandemic. One is the very, very steep gradient in risk of mortality from infection. It's really older people that this disease is deadly for. I think it's still the case that something like 70, 80% of the people that have died from COVID infection over the age of 70 or 65. That's so. And whereas for children, the risk was very, 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 very low relative to other risks in their lives. The second scientific fact, again, undeniable and well known, even in October 2020, is that lockdowns are tremendously harmful, especially to the poor, especially to the vulnerable, especially to children. We knew that for a fact. We knew that from decades of social science work, from medical work, that social isolation, closing schools would have tremendous negative consequences on the health and well-being of the poor, vulnerable, and working class populations. If you combine those two ideas, that you get the Great Barrington Declaration: focused protection of vulnerable older people because the disease is quite deadly for them, meaning not like forced isolation in quarantine camps or something crazy, but rather resources and an orientation of public health to provide support so that even vulnerable older people could find ways to isolate themselves during times of high disease spread.
Mhm.
Whereas for younger people, especially for children, lifting lockdowns. The Great Barrington Declaration corresponded to our standard pandemic management plan that we've followed for a century of respiratory virus pandemics successfully. It's really the lockdowns that were a tremendous departure from our traditional practice. So in that sense, the Great Barrington Declaration was just a restatement of the old ideas of how to do pandemic management that had worked for a century.
Exactly. So, Martin, when you reflect on the Great Barrington Declaration, do you feel frankly vindicated? I mean, you recommended all three of you, as well as almost the million people, leaders in healthcare that signed it, essentially best practices. This is the plan that we follow. Do you feel vindicated now?
Yeah, what a surprise. 100 years of public health wisdom turned out to be correct.
Yes.
Um, there's actually one example from Canada. The, the Haldimand Norfolk health districts in Ontario implemented focus protection because of the health officer, Matt Strauss. And we now know what the result was. They had 30% less COVID deaths than the rest of Ontario.
Okay, so can you please
That's
repeat that,
just
Martin? So you're saying in a region in southern Ontario called Haldimand Norfolk, the county, they did it differently as well. That's fascinating.
Yeah, so they implemented focus protection, and they did better on COVID mortality. But of course, the major benefit is also they didn't get all the collateral public health damage.
Okay, but as I recall, Martin, that medical officer of health for that region, I believe his name is Dr. Strauss, was thoroughly criticized and, quite frankly, attacked personally on so many accounts for not going along with the way so many others did it. Is that correct?
He took a lot of heat and he stood strong. And by doing that, he saved many people's lives. So he is
So,
one of the heroes of this pandemic, one of the few.
okay, so for Jay and Martin, I know this sounds rather harsh, so I do want to qualify my question, but it seems like you wrote the Great Barrington Declaration to state, in many ways, the obvious that we needed to follow best practices of healthcare that are, frankly, wisdom over 100 years. And yet, so many authorities, not all, didn't follow that. And now, looking back in retrospect, you were clearly right. It's almost like everything they told us, masks, lockdowns, the whole story about natural immunity, even the whole challenge now of understanding how helpful vaccines are, the impacts on all of this, they were entirely wrong. Is there anything? Am I being too harsh? Is that incorrect? Is there anything that they were right on?
I think it's been disheartening for me personally. I spent, and Martin has also spent decades working in public health, working in medicine, and the principles on which I decide whether what's the correct scientific sort of a set of ideas is very simple. It's evidence based medicine. It's critical thinking. You look and see what's worked. You aim to make public health decisions that respect the intelligence and autonomy of the public. You don't make any decision that makes the lives of the poor, the vulnerable, the working class any harder than it already is. I think all of those principles, I thought, guided public health.
Mhm.
And it's been the shock of my life, David, to see all of those very basic ethical principles thrown out the window during the pandemic,
Wow.
um, especially on evidence-based medicine. On issue after issue, the scientific and public health establishment abandoned evidence-based medicine on masks, on lockdowns. It has been absolutely shocking on school closures. It has been shocking to watch the scientific establishment and specifically the public health establishment throw away this deep wisdom that has have taken a century to gain.
So Jay, I think a lot of people would be shocked to hear what you're saying. I mean, you're a preeminent leader in public health in the world, and so you're saying that, like, we heard the refrain time and time again, let's follow the science, but we didn't follow the science, did we? So what's a good example of that? What's a stunning example that people need to know about?
Well, there are like a few principles of public health that we have thrown out the window. One is public health is not about one disease, it's about all of health. It's
Mm,
not just about COVID, it's about cancer, cardiovascular, diabetes, mental health, and so on. So you can't just focus on one disease and ignore everything else, and that will deteriorate. And that's exactly what happened during this pandemic. All the focus was on COVID in a futile attempt to get rid of it, which was never going to happen, but then doing so much damage to other aspects of public health. Another thing is that in public health, you have to view it long term. If you have a hurricane, which we do in the US, what you can do is you can sort of leave your home and hunker down for a few days, and then when the hurricane is over, you come back and you resume your normal life. Infectious disease outbreak doesn't work that way. If you have a pandemic, it's going to come. You can push it forward in time a little bit, but you cannot avoid it. You have to go through it. Uh,
exactly.
so, in the beginning of the pandemic, countries were sort of competing to see who could press down the COVID the most. But then they had it later instead, and they had the mortality later instead. So those are two fundamental principles of public health. Also, of course, public health is about everybody in society.
I think that's well said, Martin. So in this context, Martin, are you concerned that we've done irreparable harm to many societies, including Canada?
Yes. Well, just take the school closings. Children need to go to school. To close the schools has effect on these kids for the rest of their lives.
Hmm.
So that will be for decades and decades to come. And they're never going to get back that education that they lost. We know that if you have less education, you do less well in life in terms of public health and many other things. So that's not going to be, that doesn't show up in the mortality statistics because these are kids, they survived.
Hmm.
But it will show up in a detriment for the future.
Well said. What about you, Jay? How would you respond to that question?
I mean, the harms to Canadians is absolutely irreparable in so many ways. Martin already mentioned the all cause excess deaths in Canada, which is, I think it's like nearly double the cumulative all cause excess deaths through the pandemic for Sweden. Um, the other things are for the living. The other things are still going to last for quite a long time. I mean, I think a lot of times during the pandemic, people have said, "Well, we have to trade the economy off so that people can live." But in fact, the economic harm to Canadians has been tremendous. Huge numbers of businesses, especially small businesses, are closed now that otherwise would be. You have inflation, you have high unemployment. Um, You have essentially like a debt overhang. Um, these have health consequences, David. These are not simply just money. The money buys the capacity for people to live longer, healthier lives. And recessions and inflation are all bad for the health of the public, especially the poor. Um, the other thing I'd say about the Canadian response, the Canadian response was particularly cruel to the unvaccinated. It made it so the Canadian policy for the longest time was that if you were unvaccinated, you couldn't even travel internally within Canada on a plane or a bus. That's unique. I mean, that's not very many countries did that. Um, and as a consequence, a lot of lives were ruined. Even people who had already had COVID and recovered, and thereby were actually at lower risk of spreading the disease to others than someone that was simply vaccinated and never had COVID. They also were subject to the same discrimination. Um, I'm like, I just try to put myself in the shoes of somebody like that. What they must think of public health, what must think of government that embraced irrational discrimination against them, destroying their life prospects for the idea that you could stop the spread of a respiratory disease that was very clear from the very beginning that was not going to be possible to stop.
Exactly. I think, Jay, you make an excellent point, is that part of the irreparable harm is not only cascading through the economy and its impact on people's livelihood and indeed their health, but is ironically on the trust that we would have in public health officials now. Um, I hear this from a lot of people, is heaven forbid that we would have a real pandemic and how we would then respond to instruction from public health officials. It's really ironic, isn't it, Jay?
It absolutely is. The collapse in trust in public health is nothing like I've ever seen in my professional career. And I honestly don't know how to get it back. I think a good first step would be an admission of catastrophic error on the part of current public health authorities, that they made mistakes. And frankly, I would ask that they would apologize to the people that they harmed, that discriminated against. So many people fired because they didn't take a vaccine that they weren't convinced would be good for them. Well, why weren't they convinced? Because public health basically denied the basic principles of evidence-based medicine, denied immunity that there was immunity after COVID recovery, overemphasized beyond what the evidence showed regarding the efficacy of the vaccine to stop transmission, underplayed the possibility of vaccine harm. A lot of people have looked at how public health has behaved, the pronouncements they've made, they compared it against the reality they see, and they're very different. And so it's no surprise they've lost trust. But it's bad for the public, for public health to not be worthy of trust. Public health is very important for the health of the public, I think, David. And so I think it behooves public health authorities to work to restore that trust, and that's going to require self-reflection and, frankly, apologies from the leaders of public health.
Exactly. Um, Martin, I did want to turn to you because you're a biostatistician and you're very familiar with vaccine development. It seemed like during this whole last 3 years, the authorities have really weighed in heavily that the answer to this virus was really all about vaccines. Was that correct?
Vaccines was one important measure against the pandemic, but public health got it completely wrong. The thing is that just to say that everybody should get vaccinated is just as scientifically flawed as saying that nobody should get vaccinated. So for older people in their 70s and 80s, they were very, very high risk of mortality from COVID, from dying. And the vaccine saved many lives among this age group. But that doesn't mean that if you've had COVID already, you already have better immunity than if you're vaccinated. So you don't need to have the vaccine. And if you're young, if you're a child or young adult, you have also minuscule risk of COVID mortality. So you don't need a vaccine. So if you're old, even if there's an adverse reaction, a small risk of an adverse reaction to the vaccine, it's still worth it because the protection, because you have quite a high risk of dying from disease, from COVID. But if you are a low risk from COVID, even a small risk from the vaccine will put the sort of the benefit risk in the negative. It's not worth taking. So the public health establishment sort of completely got it wrong by saying that everybody needs to get this vaccine, and it actually killed people because in beginning of 2020 there was a shortage of these vaccines, and you could see people on Facebook and Twitter who were bragging about, like they were 30 years old, bragging about how they got the vaccine and how virtuous they was for getting the vaccine, even though that vaccine should have been used instead for my 85-year-old neighbor who didn't get the vaccine at the time. So uh, old people died because they didn't prioritize getting the vaccine to the old people, and instead there was young people who was virtue signaling about getting the vaccine, or they were forced to if they were at the university. There was a vaccine mandate; they were forced to get it, while those in the 80s were not forced to get it. So a lot of young people got it who didn't need it, while a lot of older people who would have benefited from it didn't get it.
So that makes a lot of sense, Martin. Vaccines can be helpful, but target them to the most vulnerable, namely older persons with multiple health challenges. I think what's also fascinating to both of you, this is a question, is it relates to therapeutics. It's like the virus came along and the only answer was putting someone in isolation, even on a respirator. I remember when there was this huge push to manufacture respirators, and then there was no almost an incredible prosecution of people who, like as physicians, that would be recommending other treatment alternatives. And this seemed bizarre to me because surely as a physician, you want to relate to your patient and they want to customize a particular solution to a health challenge. But it's like the government intervened in that kind of relationship. Is that a fair assessment, Jay?
I think it's completely fair, David. I think, like take respirators. It's not a surprise that we had, in some extent, such high mortality early in the pandemic. We overused respirators, used respirator protocols that were not standard, and very quickly, the World Health Organization recommended changing those respirator protocols, and
Sorry,
the mortality
hold
rate
on for
dropped.
a sec, Jay. What do you mean by we use protocols or use of respirators that was not standard? What does that mean?
Like in particular, we used criteria for deciding whether patients should be on a respirator that would normally not be used, right? So just a low pulse oxygen does not automatically mean you should be on a ventilator. Um, you use other clinical criteria. The way we manage patients with COVID now, and even, frankly, even in just summer of 2020, is vastly different than the way we managed them in March of 2020. Um, Now that you can, I mean, some extent you can excuse. It's a new disease, and people don't really know what the right thing to do is. I can understand that's complete, to me at least,
Mhm.
understandable, right?
Yeah.
Um, What's less understandable is that it seemed like almost a lack of interest in doing a rigorous evaluation of promising early treatments. From the very earliest days of the pandemic, there were doctors that were with lots of experience in
Mhm.
who were putting forward hypotheses about how relatively cheap drugs might be used. Hydroxychloroquine, which I actually now exposed, think that probably didn't work, but there were other more promising ones like fluvoxamine.
Mhm.
Um, there were cheap ones that did end up being quite prominent, like dexamethasone for managing patients in a hospital setting. That in the UK, there was a rapid randomized trial. The US NIAID, the National Institute of Allergy and Infectious Disease, has as its job to evaluate this evidence. And they were very, very slow to do it. The randomized trial, for instance, for ivermectin, for in the U.S. called Active 6, didn't actually complete until 2023.
Mhm.
What needed to happen, and this is a rapid evaluation of high quality randomized evidence of all of these inexpensive drugs, conducted by organizations like the NIAID, who have a job that's their primary job. The scandal is not whether a particular drug worked or didn't work. We didn't know until the evidence starts to come in, right? The scandal is that our public health agencies, our scientific agencies, did not support rapid evaluation of these relatively inexpensive drugs, whereas, of course, it did support the rapid evaluation of the vaccine. It should have been an all hands on deck kind of approach,
Exactly.
rather than the sort of put all your eggs in one basket kind of approach in 2020. It's 2020 that is the scandal.
So both of you have been part of another group of eminent scientists called the Norfolk Group, named after where you met, basically laying out a series of questions that need to be answered. So can you tell us more about those questions that we should be asking now as we look back and forward to the future? Martin, did you want to talk about that?
Yeah, so it's an 80-page document where we ask a whole long list of questions, and it's available both in English and French for so that everybody in Canada should have access to it. And we have divided it about questions about the thing we talked about the therapeutics, about school closures, about other lockdown measures, about testing, about the face masks, and so on. And it's a bunch of questions that needs to be answered to evaluate how we did during this pandemic.
Well said, Dr. Bhattacharya and Dr. Martin Kulldorff. Thank you so much for being with us today in this far-reaching conversation about lessons learned from COVID-19. We thank you so much for your courage and your commitment to the truth, and as we walk on this journey together. Thank you for joining us.
Thank you for having us.
So that brings to a close our discussion today about COVID-19. We're so glad that you could join us, and be sure to continue to keep in touch with the Frontier. Please subscribe to our newsletter and check out our website at www.fcpp.org for more information.
Thank you for watching Leaders on the Frontier. We're a nonpartisan think tank. We explore ideas, policy, and practical solutions that can make a difference in the lives of Canadians. We do not accept any government funding. We work for you. Thank you for supporting Frontier. Visit fcpp.org to give. While you're there, be sure to check out our latest articles and research. Without open discussion and debate, you're not thinking, nor are you free. Comment below. We'd love for you to join the conversation.